What's going on, everybody? Welcome to the Freedom to Flourish podcast. Today marks the start of our monthly guest episodes. So today I'm here with my good friend and colleague, Dr. Joel Miller, as always. But we have Dr. Grady Donohoe on. So he's been doing some really great work lately with his own practice and getting all kinds of stuff going for online stuff. He's got a health circle community thing that he's building and really doing some great stuff. So he does things a little bit differently than us in practice, but at its root, it is applied kinesiology and functional medicine. So we figured we'd just start having people on to bring some different perspective and kind of this echo chamber where Dr. Joel and I have a lot of the same opinions. So we'd like to hear some different perspective from Dr. Grady today and just hear about what he's doing and what he's got going on. So Dr. Joel, Dr. Grady, how are you guys doing?
Doing good.
Doing well. Dr. Grady, so glad to have you here. We when we were thinking about the different guests we wanted to have on, your name kind of popped to the top pretty quickly just because of I think just our relationship in the past, working together. For those that don't know, Dr. Grady was one of the first people that was teaching me applied kinesiology back in trimester 1 when we would be at your place on, it was like every Monday evening and things like that. And I remember the very first group, it was me and I believe 2 other people. I believe it was Rachel and Maggie. And the cool thing was when Dr. Grady was in school, he was never canceling those nights just because it was 2 people showing up. It was like, I'll be here and I'm happy to help. And that was awesome. That Dr. Grady, big thank you to you. That always meant a lot, and I'll never forget that. So, thanks again.
Yeah, I love doing that stuff. So it was always a pleasure.
Yeah, it was great. And literally within, I don't know, a year, we had one year, maybe 2, we had a huge couple classes come in that were interested in AK. And before I knew it, I was coming to these groups as I'm in between studying for boards and all that. And we literally would have 20 people in your house, and your house didn't fit 20 people.
No,
And so we had people downstairs, we had people upstairs, we had literally 4, 5, 6 chiropractic tables set up. It was awesome. It was a little training camp, so it was great.
Yep.
All right, Dr. Grady, tell us a little bit before we want to get into kind of your story. We want to learn more about you, and then we want to talk about your approach, the types of things you see. We'll get into a couple specific conditions, type 1 diabetes, and gut health, and whatever else comes up. But first, before we jump into all those things, just give us a quick kind of insight into where you practice, what kind of patients you see, and just share kind of a couple pieces there, and then we'll get into a little bit more of your story.
Okay. Yeah. So right now I'm practicing in the Phoenix area, specifically Mesa and Scottsdale. And for the most part, I see basically chronic illness. Most of the time that has to do with gut health, because for the most part, most things relate back to the gut. And but specifically when people have gut issues, that's kind of the main thing we kind of market to. But we get all sorts of things that come in, especially when you start helping people. They just start referring, just about anybody in there. So we get some weird cases every now and then. And then probably a decent amount of brain stuff as far as depression, anxiety type stuff. And, pretty much all your autoimmune cases will come into. But so in general, I always tell people, it's just chronic illnesses. So those types of things, anything relating back to inflammation is kind of a lot of the patients that come in.
Yep. Love it. And we'll talk about this a little bit more, but on your social media, specifically Instagram, I know you're always talking about multiple types of different conditions. And I think that's one of the reasons why a lot of people like to follow you, is because you're always touching on different things from a holistic perspective. And obviously that's super, super helpful. So, all right, let's jump into this. Dr. Grady, tell us about kind of the initial onset of, hey, what got you interested in health? Obviously you grew up in Nebraska, ended up in school in St. Louis. But what kind of got you interested in health? And did you always know you wanted to work in holistic health and in functional medicine and all that fun stuff?
Yeah, definitely did not, because I didn't even know this whole field and this stuff even existed. But basically it kind of started with with my chiropractor. So I was a wrestler from a really young age, and my neck and back were always jacked up. So going to the chiropractor, I was always just amazed at how I'd walk in there like hardly able to move, and then walk out of there feeling pretty darn good. And so that was always kind of in the back of my mind, not necessarily like ever thought about that as my actual profession. And then when I got into undergrad, I was playing football. And so I was just doing, I was basically thinking about being a personal trainer, and because I really liked working out. And then I quit football, and I'm like, there's just this big void in my life. Like I need a challenge. So I was looking through like different options in our college, and they had a articulation agreement with several chiropractic schools where you could basically cut a year out of undergrad and go straight to chiropractic school. So I thought, hey, that's pretty cool. I've been to a chiropractor most of my life. I like it. This sounds like a great opportunity. So I jumped on that. And then when I got to chiropractic school, that's when everything changed, because I thought I knew what chiropractic was and what chiropractors do. And then I got there, and I'm like, holy cow, there's all these different techniques and there's all these different avenues you can go down. So I just went to as many clubs, seminars, anything possible to kind of learn different techniques and also just different information. So I got there, and at the time there was a functional medicine club. It was only my first trimester, and then it like fizzled out right after that. But the email list was still there, and there was a doctor that was coming to speak. And so I got an email like, hey, there's this doctor that's coming to speak this Friday at this library. And I'm like, hey, I'm not really doing anything. So I went and checked it out, and he started talking about autoimmune conditions and how you can help them and how they can start. And specifically, he named type 1 diabetes, and I'm a type 1 diabetic. And at this point, I've been type 1 diabetic for almost 10 years at that point, and I had never heard any of this. And I'm like, why is this the first time I'm hearing about this stuff?
Right.
And so that's what really kind of hooked me, and I started really diving into the functional medicine side of things. And he was actually in St. Louis to teach a seminar series, and that was the DAPC seminar series. And so that's the coursework that I ended up taking, and then kind of the rest was history as far as that stuff goes. But I would say the main thing that kind of like always was on the back of my mind, or maybe eventually pulled me into this stuff, was my own health and with type 1 diabetes. And then, like I said, learning how that even started in the first place. And that just kind of gave me a whole lot of like perspective and just like almost relief, like knowing what's going on in the body and why things start in the first place. Like it wasn't necessarily my fault, or in some ways probably was, as far as diet and stuff goes. But it was just like, I don't know.
It didn't happen for no reason.
Knowing answers is like a huge like relief for a lot of people. So so I think that's what really pulled me in.
Yeah.
I think that's
yeah,
great.
absolutely. That's one. Sorry, go ahead, Dr.
Yeah.
Tim.
Yeah, I mean, correct me if I'm wrong, but I would bet the majority of people that we went to school with, there's some sort of tie of like, oh yeah, I went to this doc and they really helped me out, or I have this condition and this is why I get into it. And, you know, I have an autoimmune condition myself. Like I have eosinophilic esophagitis. I mean, one of the greatest, best things that ever happened to me was going to somebody who does AK and was able to help me out. So, and then most people call the office and they're like, I've gotten answers anywhere else. And that's why I really think that the combination of the training that we have is so great, because we can, we understand the underlying chemistry and immunology and all these things that lead into what, drives problems. But then from there, regardless of what the issue is, we can demonstrate and provide in real time with the muscle testing. And so it's just this great combo. So anyway, that's really great. And I feel like it provides like this fire of trying to learn and aggressively know what drives and causes stuff, because it's not only your patient's health, it's your own health that you can try to improve as well.
Mm-hmm. Yeah. And that's a great point about like AK, because going through school, like I said, there's so many different techniques and ways to assess the body and all that good stuff. And, going through the DAPC course, they're mainly talking about blood work and lab work and stuff like that, which is fine. But it's also a matter of not only figuring out what's wrong and what the cause is, but also like what you're going to do about that. And so that's where AK really, it's just like I couldn't unsee it and I could not do it because it just gave so much more clarity as far as what my treatment protocol is going to look like and is it going to actually work. Because you could, any one condition, you could have like 20, 30, 50 different supplements that research says is helpful for this, but what's going to actually work for that person. And so that's why I love AK. You can really hone in and figure out what's going on.
Yep, for sure, for sure. So if you're similar to me, was it you didn't know about AK until you got to school?
Oh yeah, for sure. Yeah, I just went to a club meeting and they were doing basically kind of like a demonstration, and I'm just like, what is this stuff?
Yeah, my first experience was very similar, and they were looking at trying to fix. I think it was this guy's like rotator cuff or something. He had some pain or something with his shoulder, and the doc ended up adjusting. It was Dr. Bovin ended up adjusting the clavicle, and I was like, number one, I didn't know you could adjust a clavicle because nobody talks about that, and that's definitely not your normal adjustment. And then number two, he adjusted it and it like fixed the guy's rotator cuff. And I was like, what in the, I was like, that's amazing though. Cause how otherwise would you have known without the muscle testing and the different reflexes? Otherwise, how would you know that that's what the guy needed? That's what the adjustment was needed. So, and then of course, the more you jump into applied kinesiology, you realize you can start testing nutrition, you can start testing infections, you can start testing all these different things. And that's where it gets really, really fun as practitioners because we're actually able to complete the picture for the patient and actually give them answers of like, hey, what's actually going on here? And what do we actually need to do to fix it? So definitely makes providing care for people a lot more enjoyable for sure.
Oh yeah.
Let's see. What are some top experiences or memories from school? I know this one's kind of a pop question here, but is there anything that comes to mind? Top memories or experiences, or even some of the top people that you met that you just always will have relationships with?
Yeah, I would say going off of your last point, as far as like making it enjoyable, something that really highlighted that for me, as far as like what really solidified me doing applied kinesiology in practice, because obviously with applied kinesiology, you're taking a lot more time with people, which is great, but at the same time, like from a business side of things and a money making side of things, it makes it pretty hard to see a lot of people. And so like there's always that, is this a good path for me type of thing. And then I went on a mission trip. I think it was in trimester 8 to El Salvador, a chiropractic mission trip. And down there, we didn't have any translators. So there's no possible way, and I don't speak Spanish, so there's no possible way for me to do AK with people who I can't communicate with.
Yeah.
So I was just doing like, straight chiropractic, and literally not even the first day was over and I was just bored to tears doing this, feeling like I'm doing the same thing over and over again. And also maybe not even like finding the true causes of different things. And so that really solidified to me like what I was going to be doing in practice and with the rest of my life. Because like I said, if I had to do relatively the same adjustments all day long, I would get super bored and I would get burnt out super fast. So that was like a big kind of like, not necessarily turning point, but it just like solidified my choices going forward.
Yep, for sure.
That's awesome.
Yep.
Here's a question in response to that. So if you felt like you were bored to tears doing the same adjustments every day, are you feeling like you're kind of in the opposite boat right now and that you are just way too mentally taxed with the functional medicine and AK stuff in the practice that you currently are working at?
Not really. I feel like I always feel like it's just like a puzzle. And so I don't know, I feel like I just get excited. I almost get more excited with like the real hard patients and really trying to figure out like whether it be like what tests I need to do or what things I need to investigate or just like what's gonna work for them. Not only like the things I'm recommending, dosage, all that good stuff, but also like lifestyle stuff. That's kind of like the piece where AK is not necessarily going to help you a ton with. But like, because it not only takes like knowing what to do, but also how to communicate that and how to inspire and motivate them to really make those changes. But yeah, like as far as the AK piece goes and the functional medicine side, I kind of thrive off of that and really love it because it like pushes my brain a little bit. I don't know. It feels like a fun game to me.
You can feel like you're making more of a difference, I think.
Go ahead, sorry. Yeah, it feels like it seems like that's kind of the response from most, I would say, people in AK systems healthcare, all that stuff is we love the I don't want to say we love the challenge, but we love putting it all together for people. And it actually, I mean, it is pretty hard work. That's why I think a lot of people aren't trained in this. And I've asked other people too. It's like, hey, you were training in this. Why'd you stop? And some people literally just say it's just really hard. It's really difficult. And the amount of time and effort it takes to learn these techniques and learn these approaches and all those things it can be a lot. It can be a lot.
Mm-hmm.
And then of course, getting into practice, it's not for the faint of heart. So yeah. All right, let's kind of switch over here and talk a little bit more clinically. So obviously you shared that you're there in Phoenix and seeing a lot of chronic health cases. Tell us a little bit more about your approach, and I imagine it'll be very similar to ours, but for the listener, someone comes in, they have condition XYZ, and usually it is multiple conditions. They come in, what kinds of things are they, or let me say this, what's your approach? What's the mindset that you're going into things with? And what are a lot of the things that you're sharing with patients on that front?
Yeah. So obviously, first things first, taking that history. And while you're taking that history, you're just trying to listen to different keywords of what's not only like the main things that they want to focus on, because sometimes that's maybe a little bit different because we maybe see things from a metabolic standpoint, and it's like, well, we're probably going to need to work on that first in order to fix that other thing. And then so that way you can kind of, if that is the case where you have to maybe address something first, you can kind of communicate that, so that way they're not maybe expecting that one thing that they're really focused on, like hair loss or something like that. That's maybe not as important from a metabolic standpoint, but it's important to them. So you can kind of address that and how that progression typically works for most people. And then at the same time, listening to different things of like what they're doing maybe in their lifestyle that is contributing to their problem. So you can start kind of either talking about or at least noting down different things that you're going to need to talk about later as far as what changes they need to make. And then usually, most of the time, I don't necessarily address those right away because I want to get an assessment first to really kind of hone in on what we really need to focus on. And then we just jump right into the assessment. So first going through and finding those muscles that are weak, and finding those reflexes that are organ reflexes that are correlating with that. Going through all the vial testing and nutrient testing. Once we get through all that and we have, all right, these are the supplements we're going to start with. Then we kind of sit down and go through game plan as far as what dosage and or taking those supplements looks like. And then jumping into diet, lifestyle, home remedies that they can do to really help promote that healing process. Because there's only so much supplements are going to do for you, at least in my opinion. If you're not doing all the things on the diet and lifestyle side of things, we might get some progress, but you're probably going to be right back in the same situation eventually. So I always try to focus in on that and hone in on that and try to make sure that that's a priority for people. Even though most people coming in really just want the pill or the capsule that's going to fix them. But that's usually a big focus for me, especially day one.
Yep. That's huge. What are some of the most kind of common health issues you see? I know you mentioned things like a lot of gut health issues, autoimmune issues. And I think you kind of mentioned this, maybe there's some more that we can talk into this, but kind of mentioning that no matter what, a lot of the health conditions people come in with, it seems like a lot of it goes back to the gut health. But I know on your channel also, you've talked a number of times about different things with hormones and inflammation and lymphatic flow and sleep and all these different things. And so tell us a little bit more just about that. I mean, it sounds like you're seeing obviously a lot of different stuff.
Mm-hmm, yeah. So, well, I mean, in our society today, there's just so many different stressors that are on our body, whether self-induced or not. And so things will manifest in different ways. And that's kind of the point of saying chronic conditions, because for the vast majority of those cases, depending on what condition you have, it's almost comes back to the same list of different things. So like infections, toxins, and diet and lifestyle stuff, sleep habits, those types of things. Those are all the things that we're always addressing. It's just that with different people, we're going to be focusing on different things because they need more help in a certain area. But a lot of those things come back to the same few set of things. And gut health is usually one of those things because, the vast majority of our immune system, some say 60 to 80% of our immune system is in the gut. So if you don't have a good gut, both digestion, infections, dysbiosis, that type of stuff, it's going to be really hard to gain progress from an inflammatory point of view because most chronic conditions are driven by inflammation. And it's just that's where that inflammation is being concentrated, is around that certain organ or around that certain condition. So that's why for the vast majority of cases, at least initially, we're working on a lot of gut stuff. But there are a few cases where it is maybe being driven more by the hormone imbalance, and that might be because they're under more stress mentally, emotionally, or they're not sleeping well enough. So there's just so many different factors that go into a lot of those conditions. And so, like you said, most people have a list of symptoms or a list of problems that they have. And so the fun part is figuring out, well, okay, what's the thing that's impacting their system the most, and then trying to chip away at those things.
Love it. No, that's awesome. That's a beautiful picture that you just painted, and I think Dr. Tim and I couldn't agree more with a lot of those things. Type 1 diabetes. This is something that you've not only, of course, become very knowledgeable about as a condition, and we've talked about gut health, but maybe we'll get into a little bit more. But with type 1 diabetes, this is also something that you've experienced personally, and I think that all practitioners can attest that if we've come across something personally that we've experienced health-wise, we actually usually become that is the best way to become knowledgeable about that condition, is when you experience it yourself and then work through it and figure out, okay, how do we get to the bottom of this and all those things. Tell us about type 1 diabetes. Tell us about the I guess the most important things that you've learned about the condition. And for a listener that's listening that maybe has type 1 diabetes and they're dealing with different issues with energy or sleep or whatever it might be, what are a lot of the things that you like to encourage patients in and talk about when it comes to type 1 diabetes that most doctors aren't talking about?
Yeah, so I would say the biggest pet peeve that I have is that when you are diagnosed or when you're in the hospital with type 1 diabetes, when you're first diagnosed, there's not a whole lot of education. And that's really the most important part of type 1 diabetes, is learning what affects your blood sugar. The only thing really you get from mainstream medical, especially when I was diagnosed, I think it's maybe getting a little bit better, but that's probably more so because people are getting it from podcasts and stuff, which is like everything affects your blood sugar. It's not just carbohydrates, because that's all they tell you when you're in the hospital. It's you just have to count your carbohydrates and you take insulin for the amount of carbohydrates that you have. And when you go off of just that information, you are going to be severely inhibited on your ability to control your blood sugar. And you're going to be extremely frustrated because you're like, I'm doing what they said. I'm doing all the right things, yet my blood sugar is sky high, or it's swinging back and forth. And that's because there's so many other things that affect your blood sugar, like protein intake or fat intake, and how that slows down the absorption. And so if you're taking insulin at your normal time right before you eat some sugar, but you've had fat and protein on board, then it's going to slow down that absorption. So oftentimes you will crash, and then you're like, oh crap, I got to eat a bunch of sugar to bring it back up. And then that's when that other carbohydrates kicks in, and now you're spiking super high. Activity levels, stress levels, sleep, all that stuff affects your blood sugar. And so oftentimes, especially when I was younger, I just get frustrated because I'm like, I'm doing all the right things, and yet just randomly it seemed like, my blood sugar would spike or my blood sugar would crash. And it's just like, this doesn't make any sense to me. And so getting into this field and the kind of learning more about overall how the body functions, it starts to make more sense why, my blood sugar spiked at this time, or why it crashed, or, all that stuff. So I think the biggest part with type 1 diabetes is education and then getting data on yourself, because you can learn about, how a certain thing affects your blood sugar, but how does it actually affect you? Because depending on who you are, you may react differently to the same stimulus. So like a good example is exercising. Exercising most oftentimes is going to bring your blood sugar down, but with high intensity training, sometimes that spikes your cortisol and or your adrenaline to where you're going to mobilize more sugar and your blood sugar is actually going to go up. But depending on the person, you may not have that same response. That's like generally across the board. That's what most people experience. But for me, I'm much more of a parasympathetic person, and I almost have to get myself ramped up for things. And when I work out, even high intensity training, it's most oftentimes going to crash. If anything, it'll stay flat. Very rarely does it actually go up because of that stress response. Whereas somebody like my roommate in chiropractic school was also a type 1 diabetic. He was much more sympathetically dominant. And so like most different stimuli, like stress stimuli, like exercise, they would raise his blood sugar. So first of all, education and learning what things affect it, but then also getting your own data. So like continuously checking your blood sugar, whether you're using a CGM or you're doing lots of finger sticks, because that really helps you hone in on how your body responds to different stimuli. And that gives you a ton more information on how you need to set up your life or dose your insulin, or at least be able to predict what's going to happen. Let's say you're not going to get enough sleep that night. All right, so I'm going to increase my basal rate or increase my long-acting insulin the next day, so that way my blood sugar stays stable. Because when I don't get enough sleep, it's going to stay higher. So that's kind of the main thing that I always tell newly diabetics is education. Learn as much as you can, and then at the same time, learn as much as you can about yourself and how your body responds to those different things.
Yep, that's huge. Do you see a lot of type 1 diabetic patients in practice?
Not a lot. Unfortunately, in the type 1 world, there's just not a lot of, I guess, interest in like holistic stuff, because it's just, for one, there's not a lot of like solid answers as far as like reversing things. I would say in general, at least from some of the practitioners that do work with a decent amount that I've talked to, it's easier to reverse it or at least stop it or inhibit it when you're in the honeymoon phase, which is basically where your pancreas still produces some insulin, but it's not quite fully dead yet.
Yeah.
Versus somebody like me who's been fully like no insulin producing for years and years. It's going to be a lot harder to actually make any improvement on that, because not only do you have to work on the inflammation that started it, but then now you need to regenerate those cells, types of things. So there's just not a lot of like, I guess, perceived benefit from seeing somebody like me. And so unfortunately, there's just a lot of people who, like I said, just take insulin for their carbohydrates and don't think diet has a lot to do with it. Because there's a big movement and push, or a big narrative, I should say, in the type 1 community, where it's like they feel offended if you tell them you shouldn't necessarily eat sugar or eat a lot of carbohydrates. Like, to me, and this is my experience, but low carbohydrate diet makes it so much easier to control your blood sugar when you're type 1 diabetic versus the standard American diet. And so like people get offended or mad when you tell them, hey, you should probably eat a low carbohydrate diet, or you shouldn't eat that donut. No, I can eat my donut. I just need to take the insulin for it. And it's just like, well, yeah, technically you can, but your health is going to be way better off if you don't overall. And then at the same time, it's going to be way easier on you to control your blood sugar when it's not swinging up and down like crazy.
I think I've had that conversation with some of my family members, and they're not type 1 diabetic. No, that's awesome.
I got a question for you. So you mentioned continuous glucose monitors when it comes to type 1 diabetics. And I mean, I don't know about you, Dr. Joel, but I would think that having one of those as opposed to pricking your finger all the time would be awesome. I actually get a lot of patients asking me about those, even though they're not type 1 diabetic. They're just kind of those body hackers where they have, they have their Fitbit, they have their Apple Watch, they have the, whatever that ring is called now.
Or ring.
And then, what was that?
The Aura ring.
There you go. Exactly. And then they want to do, CGM. And so the problem that I've come across with people that are kind of in this category is I feel like they stick way too much to the objective data they gather through that, and not about how they feel. So I kind of want to hear your take on what your thoughts are with continuous glucose monitors and people who are not diabetic, because I have my opinions. I'm curious what yours are.
Yeah, so I think in general, for the most part, as long as people's psyche doesn't get into it too much, more information is generally better. However, people can get hyper focused on numbers and, like you said, not necessarily focusing on how they feel. And that's kind of like my viewpoint on lab work or blood work in general. If you feel great and yet there's a marker or maybe a few markers that aren't quite optimal, and you're like stressing and focusing on trying to get those in the optimal range, I would say you probably are focusing on the wrong things, and just kind of be happy with where you're at, because everybody's normal is going to be different.
Yeah.
And that's kind of the case with blood sugar too. On top of that, though, I would say trends are more important as far as continuous glucose monitors than the actual numbers go, because you're not actually measuring the blood, you're measuring the interstitial fluid. And so the accuracy of those is going to be off a little bit. They're getting a lot better, but they're still going to be off. And so if you're focusing on the actual number, then you need to confirm with a finger stick if that's the actual number or not. And then and at the same time, like you said, you're focusing sometimes too much on a particular thing. But if you're going off of trends, usually you're pretty safe as far as not like putting yourself in a hole as far as going down or being obsessive about it. So I think for the most part, it almost kind of more depends on the person. Like if there's somebody that's super high strung and wants to be like super optimal human being, then it's probably not the greatest thing. I usually tell people, I think it's beneficial for most people to be on a CGM at least for a period of time, like, most of them are like 14 or 15 days at a time. And especially if you are actually focusing on improving something, like let's say you do have some symptoms that indicate some blood sugar dysregulation, then I think it's beneficial to, at least for a period of time, see if there is anything that's affecting you from a blood sugar perspective. And at the same time, even in general, for the most part, it is kind of helpful to know, is there something that I'm doing that maybe is stressing out my body? And usually you're going to see that from like, if you do have a fitness tracker or something like that. But at the same time, you can kind of confirm that with the blood sugar. So yeah, I think in general, they're pretty beneficial, but at the same time, I agree with you. People can get super obsessive about it. And I have had those people where it's like, I have to kind of talk them down from the cliff as far as like, your data actually looks really good. I don't think you need to worry about this at all. I also have other people where it's like, oh yeah, I was only like 198. And I'm like, no, that's not great. We need to work on that.
Yeah, that's funny. Yeah, I could go one way or the other, but I feel like, I don't know if this is on the medical side too, but anybody who is really gung-ho about their health to the point where they're trying to optimize using functional medicine, I feel like they can really, really hardcore with sticking to the labs and all that stuff. So yeah, it can just kind of be all over the place. But yeah, I appreciate that. That makes a lot of sense. I think there's definitely a time and a place. I never thought about it like just gather your data, see what your trends are, and then move on and try to implement things and see how you feel changes and all that stuff. That's never thought of it that way. That's really good.
Yeah. I definitely don't think people should be like non-diabetics be on it for like years at a time. Like to me, it's like, and this is the way I use, like I have a watch that does fitness tracking, but I only use it when I'm actually trying to figure something out or see how a new exercise routine or a new diet or lifestyle routine is affecting my health. Is it affecting it positively, or am I actually backtracking? The same sort of thing with CGMs. If you have a specific goal in mind or want to see how something affects your health, then it's a good time to use it. But if it's just like, I feel good, but I just want to be optimal, it's probably not worth the money.
Yep,
Good
for
point.
sure.
Good point.
Dr. Grady, we talk a lot about gut issues on the podcast. I know you talk a lot about gut issues as well. What are some of the top gut issues you see between IBS, constipation, diarrhea, bloating, gas, all the things? And then what's usually your approach with that you're finding the best outcomes with?
Yeah, so I would say, and this is probably because of our marketing, but SIBO or like SIBO type symptoms are the most common thing that come into the office. So like lots of bloating and, kind of like quote unquote reacting to every single food, regardless of if it's healthy or not. And in those cases, the vast majority of the time it's infection based and or, bacteria based, in the sense that we have to kind of clean up the gut, get rid of infections. And then the other part that seems to be pretty important as far as not only helping people get better, but also staying better, is making sure they're producing enough hydrochloric acid, or at least have enough hydrochloric acid on board to fully digest that food. Because if you have undigested food going through that GI tract, that's just going to feed more of those microbes and make it harder for you to gain progress. And that seems to be like, people will come in having already been to either a holistic doctor or been through the medical route as far as taking antibiotics to help out with it. And they'll feel better for a time, but it usually will come back. And at least in my opinion, I think that, because specifically in those cases, it seems to be that they needed more betaine HCl, or basically acid, to help out with digesting that food. And then they were able to basically stay off of the antimicrobials or antibiotics, and or maintain their progress.
Yeah, that's huge. One of the things we talk about a lot is the standard approach to certain conditions, and then how we do things in the holistic world. And that overall conversation is huge, right? I mean, a lot of people go in with gut issues and they just easily get prescribed antibiotics, and the bacteria might be their issue. It might not even be their issue. And even if it is their issue, a lot of times the antibiotics are not super specific. And so, of course, that's where we always, encourage finding the right herb or herbs for the gut health. And of course, you have to address nutrition as well.
Mm-hmm.
All right, Dr. Tim, anything else for Dr. Grady here? I feel like we could talk on and on and on, but I know we've hit a couple of the same topics. Anything else that comes to mind before we jump into maybe like a little bit of a speed round with things?
Well, I guess like, what are your go-to herbs for the gut, Dr. Grady?
Yeah,
top three.
I would say probably Chinese coptis, also known as golden thread, is probably the top one. And then from there, probably Malia, and then probably ADP, because all three of those are pretty general as far as antimicrobial, going after parasites, fungus, bacteria. So generally, those are the ones that test the best most often. Also, results-wise, usually get pretty good results with those.
Yep. And just to clarify, ADP being oregano oil.
Yep.
Perfect. Very nice. Let's jump into this. I think this is worth a little bit of attention. Nutrition wise, we all talk about nutrition in the holistic world, functional medicine. We talk about nutrition. A lot of times, the phrase is that, your food is your medicine, essentially. How should people be eating? If someone comes in and they're just like, I have no idea what to eat, and what that should look like. Walk us through kind of the ideal kind of nutrition and what that looks like for optimal health.
Yeah. So especially in that case, and this happens, a decent amount of time, where people come in and they literally don't know much of anything. Like, they haven't done a lot of research on their own, and they haven't tried any diets or anything like that. So they're very infant in their health journey. And so for those people, if you give them a ton of stuff, they're going to be overwhelmed. And when people are overwhelmed, they're going to give up. So I keep it very simple, in the sense of I don't have necessarily a specific diet or protocol. I say follow an anti-inflammatory diet. And what that means for me, if you stick with meat, vegetables, and fruit, it's pretty hard to go wrong with most of those things. The more you get into more of the grains, that's where typically people start having more issues. And then obviously processed foods are definitely a no-go. But if you stick with those whole foods, meat, vegetables, fruit, it's pretty hard to go wrong with those. And then like if we find through testing and stuff they need to avoid something else because how their body is responding to certain things, then I might go into more depth. But in general, for most people that are starting at that like kind of base level, it's like just keep it simple. You can't go wrong with whole foods very much. And then from there, we can always tweak it or add as we go based off of what we're finding. But I always try to keep it as simple as possible for patients, unless they're like high level. They're like people who know more than I do. Then it's like, okay, maybe we need to have a more in-depth conversation about very specific things. But keeping it simple, I find works well, not only like compliance wise, but even just like, success wise.
Yeah, that's great. Are there any specific macros that you're encouraging patients to aim for? Protein, fats, carbs, any specific numbers, or is there just kind of a different mindset or approach there?
Yeah, so for the most part, I base that solely off of what their goals are and what they're trying to achieve or what conditions they have. So like if they're trying to work on their metabolic health and, we find they have high triglycerides or blood sugar is dysregulated, then it's typically more of like a low carb ketogenic. And generally, I have them start off with 50 grams or less of carbs per day to fit that. And then usually protein wise is between 0.75 grams to a full gram of protein per day. Sometimes more if they're an athlete or they're working out really hard. We might do a little bit more. And then the rest just fill in with fat. So that's kind of generally what I do as far as the low carb ketogenic for the metabolic stuff. And then beyond that, it's usually more so based around protein because most people, at least, I see mostly females in my practice. So most females do not eat enough protein. So it's usually a conversation around protein, increasing that protein intake and or increasing their fat intake because, especially if they're having hormone issues or hormone production issues, most oftentimes they need to increase their fat intake. And so then we have those conversations. But that's usually when I have like a very specific macro conversation, it's usually based around metabolic disease or blood sugar regulation.
Yep. Yeah, that makes sense. That's awesome. You just to clarify, you were saying protein 0.75 to 1 gram. Did you mean per pound of body weight?
Yep.
Perfect. Yep. That's solid. That's solid. Yeah, on the protein front, we talk about that literally all the time. Like probably every episode we get into blood sugar and protein because it just impacts everything. Probably one of the funny things I'll see in practice is when specifically with females, when I'm, asking, okay, you'll have eggs for breakfast. Okay. How many eggs do you eat? And they're like 1. I'm like, that's egg. But that happens quite a bit. And so, yeah, the women that I've seen in practice that do the best, they're eating a ton of protein.
Yeah.
And it's really awesome to see. And I've actually had a lot of females come in. I'm like, all right, let's talk about nutrition. What are you eating? And it's like, yeah, I'll have 4 eggs for breakfast, 2 grass-fed burgers, and an avocado for lunch. I'm like, this is awesome. This is incredible. And we usually find that those patients, whatever health issue they might have going on, they usually respond way better to whatever supplements or whatever changes that we're doing. And so we talk a ton about that.
Yeah. And those females are much more sensitive to stress, and blood sugar is oftentimes a big stressor for people's systems. So the more you can have that protein, the more that's going to stabilize your blood sugar. So it makes perfect sense why they respond so much better.
Yep. Love it. All right, Dr. Tim, anything else before we jump into the speed round here?
The speed round. So first thing on the list here, what are your top 3 things that you think every person should do or center their focus around to improve their health?
So the first thing is definitely movement or exercise. There's so much you can get away with health-wise when you exercise every single day, or at least, and what that means to me is like, I try to get movement in or exercise in every single day. That may not be like working out super hard every single day. So like my rest days are like, I just go for a walk or I go for a easy hike. But then I work out hard 3 to 5 days a week, depending on how well I'm able to recover and or how hard I worked out that week. So 3 to 5 days a week, working out hard and then still getting movement and exercise in throughout the rest of the time. And then sleep is a big one. So making sure you're getting good quality sleep, and that not only means the sleep itself, but also what you're doing around your sleep. So making sure you're avoiding a lot of blue light at nighttime, and then making sure you're getting up, getting some sunshine first thing in the morning. Those are all things that are really important to promote that good sleep cycle. And then detoxification is a big one for me. Almost every single patient I'm giving them some things that they can do at home to help out with detoxification, because for the most part, one, we're always being exposed to toxins. At the same time, when we start going after stuff in the body, especially microbes like bacteria, parasites, all that stuff, we start going after that stuff, it starts releasing more crud into your system. So if you're not detoxing well, then oftentimes that's where people will kind of feel kind of crummy when you start that stuff. So those are kind of probably the biggest three.
Love it. Love it. What's a diagnosis or condition that most doctors say is impossible to heal from that you would disagree with?
Oh, that's a good one. I feel like there's a lot of them out there. I would say, diabetes. Yeah, I mean, so that's a good one, because I still have hope that I can reverse my type 1 diabetes, even though I don't have any beta cells. However, obviously it's very, very hard. And then, but I do agree with, like, in that honeymoon period, that's where I wish there'd be a little bit more education out there about that. And I wish I had more opportunities to help people in that situation, to see if we could get there. I actually have one patient that was diagnosed with type 1 diabetes. I just disagree that she was actually type 1 diabetic, but she no longer is on insulin and all that stuff anymore. But I don't think she was actually type 1 diabetic. I think she had more of a stress response issue. But yeah, that would be one that I still hold out hope for.
So what are some others that come to mind, if anything else comes to mind real quick?
I would say, a good one is, as far as gut health goes, is like ulcerative colitis or Crohn's disease. Most people are going to say, that's not going to get any better. I actually have recently had a young patient that got diagnosed with that, and basically had that whole doom and gloom story told by them, by the doctor. And basically they're going to be on immunosuppressants their whole life, and all this just crazy stuff. And I'm like, first of all, you need to stop telling yourself you have ulcerative colitis, because you are not your condition. You have a set of symptoms that classify you as that diagnosis, but you are not that diagnosis. So stop thinking about that and start focusing on your health and improving your health and your diet and all that good stuff. And your body's going to heal and get better. So you do this long enough, you see some pretty amazing things as far as what the body can do. So I never quit on anybody.
Yep. Love it. What are some of the most difficult conditions or symptoms that you found to help people? I think that there's probably a group, when we talk about, doctors say you'll never, be able to heal from this. And we would say, no, it's possible, but it's extremely difficult. What might be some things that come to mind there?
I would say, like, severe, like, thyroid issues, like long-standing thyroid issues. Typically they take a long time. Basically, like, people's goal with that is to be able to get off their medication, thyroid medication. It is possible, and we see it, quite a bit, but it just takes a long time for that thyroid gland to start doing its own thing again after you get the body healthy enough to where it's in a position it can start producing it at efficient levels again. So that's a hard one, just because it takes time. And so when something takes time, it's people give up. So they feel like it's not working, or this is just not the right path. So they give up, and then so they're always going to be in that situation. Another one is Sjogren's, where basically we find that it's mainly a detox issue, where they're just severely overburdened with toxins, and so their body's basically stealing that fat away from those secretions. And so those secretions are mainly water, and they evaporate very quickly. And so oftentimes, especially when you're so far gone where you are having those Sjogren type symptoms, then it's going to take a long time for you to detox all that crud. And I mean, it can take months, even years, to really fully detox all that stuff, to really get all that back. And like I said, people aren't patient enough to do that, which I totally get. I mean, if I've been dealing with something for that amount of time, it's going to be hard to maybe stay consistent with things that are going to be helpful for me. But yeah, I would say those two things are probably the things that come to my mind.
Yep. Love it. If you had to summarize the three, if you can, three root issues that underlie all health problems?
Well, definitely gut is the one, like we talked about. The immune system is going to be greatly impacted by the gut, and the immune system is going to then direct inflammation to areas that we're more vulnerable in. So for some people, that's thyroid. For some people, that's pancreas. For some people, that's brain. So gut is definitely a big one. What else? Detoxification, like I said, is a big one too. And because we not only have external toxins, but we have internal toxins that we need to work on detoxifying. And then I would say blood sugar regulation is probably the other big one, because like I said, that's oftentimes one of the biggest stressors on people's systems, whether you're crashing low or you're spiking high or you're swinging up and down. All three of those things are going to put a lot of stress on your system in different ways. And so if you're not regulating your blood sugar well, oftentimes your health is going to suffer, both in the short term, but also in the long term.
Love it. Do you have a favorite supplement?
A favorite supplement? Not really. I've kind of become like, initially, I feel like there was probably a lot. And then now I'm just like, I'm so disconnected. Like when I'm testing supplements on people, I try to not even look, because one, I don't want to be biased and think I know everything and think that something's going to test well. And so I've kind of become disconnected from supplements as far as like emotional attachment to them. I mean, there's certain things that work really well for me, but as far as like general recommendations for people across the board, there's not like a one supplement that I think like everybody should take.
Gotcha. What's your favorite? Go ahead, Tim.
It sounds like you're not trying to sell somebody something and make a bunch of money off of it. You don't have your tagline supplement that can cure all diseases.
Yeah.
It's funny you say that though, about like blinding yourself and not looking, because with the muscle testing, it's very easy to get into this, basically influence things with your mind and trying to even subconsciously get the results that you want if you think something's going to work. And so blind testing is great. That's something that I do too. And it does help you disconnect and actually be objective with the testing. So I think that's great.
Yeah. And like the thing I learned the most from teaching other people to do AK with the students and everything is like, as how easy it is to kind of cheat the muscle test, even when you're not trying. And so I try to do as much as I can to not allow myself to cheat it. So doing blind testing or just retesting a bunch of times when I do find something, just to really confirm, okay, this is a positive test, because it's so easy to get a false positive.
For sure.
Absolutely.
What's your what's the perfect meal for you? If you have one meal, what's on your plate?
So right now, my favorite meal is probably ground beef with avocado, salt, and paprika.
Love it. All right, last one here, Dr. Grady. When you're not helping patients, when you're not in the office or working with patients remotely or online, what are the top things you like to do on a free day? If you ever have those.
Yeah. I would say probably going hiking and shooting my bow, because there's like a good hiking mountain right next to the bow range that I go to. So I usually go for a hike and then shoot my bow, and it's just like a quick, easy thing I can do. It doesn't take up the whole day, and then I don't know, scratches a lot of itches that I have. And then I guess the second one would probably be golfing, because my dad's a big golfer, so he asked me to go golfing, fairly often. So that's the second one. But that one, depending on the day, you can have a bad relationship with golfing. So I would say more consistently, the hiking and shooting is better.
Okay, that's good.
I saw on your Instagram the ground beef avocado, and I didn't think I would enjoy it as much as I did, but I now understand why you really enjoy that. Lots of salt, ground beef. I do the paprika. I've got some issues with nightshades, but man, salt, ground beef, avocado. People who are listening that are like, oh, that sounds kind of basic. It is, but it's good. I can't say I blame you.
Yeah. Yeah, and the paprika is definitely optional because paprika doesn't really have much of a taste anyways, but I just got to add that in there because it gives it a little bit of character. But yeah, I mean, it is like I could eat it literally every single day and I'd be happy.
That's awesome. That's awesome. All right, Dr. Grady and Dr. Tim, before we kind of wrap up here, Dr. Grady, I know you're doing a lot online. Tell us about Instagram, everything you have going on there. And of course, we have your tag here, but for the person that's not watching the episode, but rather listening, mention that. And then you're doing some really cool things with developing a health community that's free, I believe. Tell us a little bit more about that.
Yeah. So yeah, Instagram wise, my tag is Dr. Grady Donohoe, and that's where I'm most active, and that's probably where you're going to be able to find me the most. And so through that, I've been kind of itching that kind of teaching scratching that teaching itch that I have, and then through that, I've also really been inspired to start this health community to really kind of build a community that helps people make it feel like, one, they're not alone, and at the same time give them a little bit more detailed education on various health topics. The reason kind of why I was really motivated to do this is because there's just only so much time I have with people, and there's only so often that I see them. And at the same time, I can't walk every day with them and just like shadow them to figure out exactly what different things in their life are affecting their health that I'm just not thinking about when I'm talking to them in their appointment. So if I can provide more resources that allow them to identify maybe different things that they haven't thought about yet, that I haven't thought about yet, then that can help them improve their health, even when I'm not talking with them directly or educating them directly. And I think health journeys are a lot easier if you are doing it with other people. So if you have other people to rely on, whether it's just like you run into an issue and you have a question and you have somebody that's going to answer you right away, whether that's me or somebody else in the community that's maybe gone through a similar experience. You get a lot of different perspectives that way. And then so you feel like you have support, you have a community that you can lean on. And that way you're not doing it alone, because, especially when you are in a household where you're the only one that wants to improve their health, and so everybody else is still eating terrible, it makes it really hard on yourself, both mentally, but also logistic wise. And so having that community to really help you through that can be really helpful.
That's awesome. You may have said this, but what's the name of your health community?
Yeah, it's called the Health Circle Community, and you can find it on my links on Instagram. That's probably the easiest way to get to it. And then so there's the free part of the membership in that Health Circle community, and then I have a lot more like detailed videos and recipe books and workout plans and stuff like that, other resources in the paid part of it. So there's two options. You get a bunch of resources in the free part too, but depending on what level of help you need, you can kind of choose from there.
For sure. That's awesome. To all of our listeners, go follow Dr. Grady on Instagram, join his health circle. There's so many benefits with what he's doing in the community that's being built there. And it's really exciting to see from afar. Dr. Tim, anything else today? Dr. Grady, thanks so much for, of course, coming on. We're so thankful to have you and to get to know you a little bit better, and for our listeners to get to know you a little bit better, but also talk shop with some of this health stuff. Dr. Tim, anything else? Otherwise, I say let's kind of wrap it up.
I think we did a good job of wrapping things up. Dr. Grady, thanks for hopping on, and definitely provided some different stuff that honestly we don't normally talk about, and especially when it comes to type 1 diabetes. I believe you have a very unique perspective on that, and not only your perspective of patients, but the walk that you walk every day with your own health. So all that stuff was great, and really appreciate you coming on. So thanks.
Thanks for having me. I obviously had a great time. It's always nice to talk to other functional medicine doctors, because sometimes it feels a little lonely out in the real world.
Yeah. Yeah. You know, honestly, if we could do this every week, I'd feel the same way. So it's easy to feel like you're on an island. And then before you know it, the week's over and you're like, man, that week flew by, and then the months fly by, and it's like, man, do I have life outside of here? It just gets busy. So yeah, great. Yeah, we're looking forward to this series as a whole, of just every month having somebody on just to chat different things. So I'm sure we'll be chatting in the future about having on again, talk different stuff. So anyway, we'll get into that down the road. But let's wrap things up. So I'm Dr. Muggs down here and at Flourish Functional Wellness Center in Bentonville, Arkansas. If you want to find me online, my website is draugustiniak.com. That's DRAUGUSTYNIAK.com. On there, on my homepage, is all my links to my social media, as well as contact info for the office. Any questions, comments, concerns, or suggestions for future episodes, feel free to reach out.
Yep. Likewise, Dr. Joel Miller here. Freedom Health and Wellness is the name of the practice in the Dallas, Texas area. You can find me online, drjoelmiller.com, and then on YouTube and Instagram should be pretty easy to find. Guys, thanks so much for tuning in. Dr. Grady, so great to have you. We'll look forward to having you again in the future. Dr. Tim, as always, it's fun doing this with you. And to our listener, we'll see you guys in the next one.